Well, we know that intraocular pressure is dynamic, just like our heart rate or our blood pressure is dynamic. And we really only get a couple data points a year on patients. So it doesn't tell us very much about what's happening in the morning or the evening or the next day or 3 months from now before we see the patients. In fact, I tell my patients, I have one data point and we need many to understand what's going on. We also know that patients' intraocular pressures tend to be highest in the middle of the night or the early morning. At the same time, the blood pressure is the lowest. And it's very possible that patients are progressing in those off-hour times. And so it's really important to know what the intraocular pressure is doing.
It's well known that IOP is really the modifiable risk factor. We use it as a target in terms of how low to go. But yet when we measure in the office, we just measure one time point. So, theoretically, it just made a lot of sense that we need to think about IOP beyond the office. And we see studies that show us that peaks that occur are very often outside office hours and beyond what we typically measure. And it's those harmful peaks that we feel, certainly I feel, are where the worst type of glaucoma damage can occur.
When we try to diagnose glaucoma, we're using eye pressure and other tests, of course, and we're often looking for the highest or peak IOP. And we cannot always get that little piece of information by seeing patients in our office. So a home tonometer that was able to capture eye pressure readings during the course of a full day would be much more helpful for us in identifying those peak pressures. Speaking of peak pressures, we know that fluctuation, or the peak and trough of eye pressure as it goes up and down from day to day and week to week and month to month, is really critical for many patients in their risk for progression of future damage to their vision from glaucoma.
I've been using iCare Home for the past few years, and the process has been pretty seamless. There's a great process where patients will get data, get literature about the product, and go online, and then MyEyes will reach out to the physician. We can sign a prescription online for the patient to get that opportunity. And so it's been pretty seamless, and I've had really good feedback from patients about the process.
Until we had really the iCare Home and iCare Home 2, we didn't really have a reliable, consistent way to measure pressure at home. We developed a model whereby which we have these devices available for patients to use, typically 1 week at a time. They rent it from the office, they use it to take home. We encourage them to use it at all time points as much as they can. For one night, they can wake up in the middle of the night, they use it as well, but I tell them right in the morning to when you go to sleep, and log activities. So basically by doing that, we get a real good pattern, a real good tracing of their IOP.
iCare Home is particularly helpful in patients who are pretty well controlled, but still progressing. Because those are the patients that you need more data on to figure out whether the field is progressing because of pressure spikes or from pressure independent factors. If you could document the pressure spike, then in a patient with low pressure, then it supports a surgical intervention.
Measuring IOP at home has changed our treatment options and our approach for many patients. Simply measuring a pressure in the office just is not enough information to inform us, and being able to get a better, at home real world pressure guidance allows us to customize therapy. It may tell us to be less aggressive for some patients. It may tell us we should intervene earlier for certain patients. I think most of all for our patients, I think they have a better feel for what's happening. It reduces the unknown, the uncertainty behind what are we targeting and what are we trying to achieve with our therapies.